Hello, I'm Mihaela Schaar, and today I would like to tell you how over the last couple of months we have developed machine learning methods and implementations that we hope will change the response to COVID-19 nationally and internationally. I'm going to tell you how we moved from algorithm design to informing policy to implementation. Early on in this pandemic, in March 2020, I have written a position paper which is listed below, where I describe how I believe that machine learning can contribute to responding more effectively to COVID-19, how it can inform clinicians, medical personnel, medical researchers, policymakers, and many others to more effectively fight this pandemic. I describe the role of machine learning in managing limited resources in hospitals and elsewhere, in informing policies, inclusively lockdown policies, and improving international collaboration such that we can effectively learn from each other. I've also described the role of machine learning in identifying what treatments work best for a particular patient, as well as expediting clinical trials. Clinical trials not only for COVID-19 medication, but also how we can deal effectively with interrupted clinical trials for medication, such as for cancer. And finally, I described the role of machine learning in managing uncertainty as this pandemic is unraveling. Early on in the pandemic, we have developed a machine learning model that is informing hospitals how to better plan their resources. We have joined forces with NHS Digital, and we have begun a trial that is happening nationwide in the UK to use this tool to help clinicians and hospital managers. How were we able to do so very early on the pandemic? By using automated machine learning models used in our lab. So we call this tool Ajutorium for COVID-19. This method is providing evidence that can reliably assist the difficult decisions clinicians and managers have to make in order to save lives. We use the personalized data to forecast personalized risk for each patient from dying from COVID-19, personalized patient benefits from a variety of resources, inclusively ICU beds as well as ventilators, identifying which treatments are needed for each patient, when and for how long, which resources need to be used, as well as identifying future resource requirements at the hospital level as well as the national level. Again, we were able to do so very early in the pandemic by reusing a very general automated machine learning methodology that we have developed in our lab a few years ago. Its name is Prognosis. Prognosis was used already before in our lab to craft clinical risk scores for a variety of diseases. It is a general purpose methodology. It has been used successfully in cystic fibrosis, breast cancer, cardiovascular disease, Alzheimer, etc. And on the basis of this methodology, we are able to identify best pipelines, imputation, feature processing, classification, and calibration. We are able to issue predictions as well as explanations. So we have developed methodology in our lab on automated machine learning that can develop clinical analytics for COVID-19 at scale. It can empower the new human machine learning ecosystem to fight this pandemic. If you want to learn more about our research in this area, please look at our website dedicated to this research, or listen to my talk on October 6th at Microsoft Research Seminar Series on AutoML and automating algorithms. Also, early on in this pandemic, we developed methodologies to enable global collaboration among countries to better fight this pandemic. For that, we have developed a policy impact predictor, which is for short called PIP. The focus of PIP is to estimate the causal effect of NPI, which are non-pharmaceutical interventions, applied over time on COVID-19 deaths. And we are conducting counterfactual scenario analysis. We are aiming to understand what is the effect of different NPIs applied on a particular country at different moment in time. and ask ourselves what would happen or what would have happened if we would have applied a different MPI intervention at a different moment in time. This is important to inform governments and policymakers, and this is especially important now again because of the second wave. What is new here? Unlike previous research in this area, which focused only on predicting deaths from COVID-19, in our case, we do counterfactual scenario planning and counterfactual analysis. We are able to answer what-if questions. We are learning heterogeneous MPI effects using global data from different countries, thereby enabling them to learn from each other. In this way, we can reduce future COVID-19 deaths by international collaboration. The machine learning model that we have developed is able to model the trajectory of COVID-19 deaths within a particular country as a Gaussian process. And it's a machine learning model that's interpretable, which uses for the Gaussian process a mean function, which is an epidemiological model that is interpretable, a compartmental SCIR model. We are forecasting the deaths, which is the posterior trajectory of deaths. And the prior is this rigorous mechanistic model, and the posterior is data-driven. We are issuing not only projection, but also uncertainty estimates associated with these projections. We are able to learn across the different countries by using a hierarchical Bayesian model, which is a multi-layer model. The upper layer Gaussian process is sharing variables across the different countries, both MPI variables as well as country-level features. And in this way, we are able to learn the effect of one intervention in one country on the basis of what we have learned from another countries, while considering the differences among the different countries. We are able in this way to do counterfactual scenario analysis and answer questions both about the past policies and their effectiveness, as well as future policies. Please take a look. In addition to what I've described here, we have done research in other areas where we applied machine learning to identify the role of ethnicity, for instance, on both complications from COVID-19 as well as deaths, both in United Kingdom as well as with collaborators in Brazil. We have also looked at the effect of mortality and the variation in care in different hospitals in the UK. Together with Novartis and AstraZeneca, we have looked at the role of machine learning in empowering clinical trials in the era of COVID-19. Please take a look at our research at this website. Thank you.